Hey everybody, it's Kevin and Donna. I wanted to get you guys kicked off with some things. We'll get our intro and then we'll jump right into 5 steps for medication optimization plan on the Deprescribing show. All right, welcome everybody. I'm going to kick it over to Donna. I'm really excited for this topic today, Donna, because when you're looking at a plan, it can be so overwhelming. Like, what are you going to do with this mess? And how do I start organizing my thinking? So I was excited today.
Right. That's awesome. So I love like the Super Bowl flash for the intro. I think it's awesome. You really kicked it out of the stadium here. so let's dive in and let's talk about these 5 steps, right? So and I'll also tell you about what we're going to talk about a little bit later on in the channel. But what I think is really important is that studies have had so many different varieties of step processes, and it's all been geared towards providers. But
Yes.
we have to train our patients and our caregivers about how to actually take these steps with us, right? Because if there's no buy-in there, if you don't have that patient-centered type of buy-in and help and understanding and reducing barriers with the patient and the caregivers, you're not going to get anywhere. It's going to be barrier, barrier, barrier all the way. I think we can all relate to somebody or think of somebody who we've spoken with that has been, no, my doctor says I need it, or oh, how would I ever say anything, or I have to have these medicines. So there's just so many barriers, and they're tired, they don't want to bother. And when you have so many medicines, it's exhausting for people to even think about, like you said, where to begin. So we have the tool, and we're going to go through it. So first of all, I want to say to everybody too that this medication optimization plan is a mop, it's a tool, right? We're going to help clean up our medicine lists, and we're going to help others, do this. So the process is a tool, and we want to make certain that we use it to clean up our environment, right? So in our environment that we're talking about is medications, and the medications that could be really dragging us down, causing frailty, causing um, anticholinergic burden and things such as that, increasing the risk of falls. So if we can reduce these things, we can build a better quality of life for those that we care for and those that we're treating. So step one, here we go. Let's list all the medications. And this seems like, all right, yeah, everyone does this. But I want to talk to you a little bit about how we make this a little bit different. So, what we need to do when we're looking at listing all the medications is thinking about, does the problem still exist? What is this actually being used for, right? And then, do I really think it's helping me? So, just by listing medicines is one thing, but really thinking about them and going, what's it for? Am I still having this issue? And, is it even helping my issue if you do need treatment? Those are really important factors. And if you're uncertain, you know what? That's a great spot to start questioning, right? So if somebody doesn't know why they're taking something and then you tell them and they go, well, I had that years ago. You can start filling this in pretty easy, thinking about how somebody might be responding to your questions too. So even if the individual themselves can't fill out the form, we can be going through it with them to start getting these questions to be like, maybe that's not a medicine for you any longer. So it helps us start our process. So after that whole list is started, then you have to think about, okay, what are you self-treating, right? We want to be thinking about what's an OTC medicine that you're using, or why are you taking a particular supplement, and what made you think about that? Were you told to take it by a provider, or is it something that you decided, you heard, did some research or something, and now you're trying to take care of something that doesn't feel well on you, right? So what are you self-treating, and what might be that you're self-treating that could be a side effect of another medicine? And that's when we have to start thinking about side effects. So you can't ask a patient, So, experiencing any side effects? How are they going to know? So, we as pharmacist sleuths need to be figuring out, what are they treating and is it a side effect that they're treating versus a new problem? So that's going to help us figure things out as well. So, step
Okay.
2, we are going to be thinking about reviewing the medication list and really coming up with these questions and really formulating, start thinking about this might not be necessary anymore. This problem that you're saying you had years ago, for example, um, I've had people that told me that they had seizures when they were in their 20s or 30s, and they're still on seizure meds in their 70s and 80s. That is not appropriate medication use, most likely, especially if they've never had another seizure within those, 40, 50 years. So we have to start thinking about, you know, convincing and having these conversations saying this is not necessary any longer. So it could be depression, it could be anxiety, things that have resolved. It could be pain that someone is still on pain medication for post surgery when the surgery was supposed to take care of it, or they've been to PT and the issue has resolved. So a lot of things like that that we want to be reviewing and then really start putting those question marks and helping the um our patients come up with questions, right? This is the conversations you want to have with your providers, or maybe it's something that we are taking care of in helping the patient and talking to the providers for them. I've had a lot of patients say, I feel really good about going and seeing my doctor now after I've given them information, and they feel empowered to have really good conversations now because they've gone through this process and they started with the tools and they now have questions to ask, and they understand like why they're asking these questions. So sometimes patients feel empowered to do that. Other times patients will say to me, you know what, it makes sense to me right now, but I don't think I'm going to say it well. I don't think I'm going to be able to express what you are telling me, but I want to. So would you take the time to speak to my provider? And that of course is fine. So I allow that in the conversation too. I allow it to be, are you comfortable with this, or do you want me to help you out with this? So those are great things. Oh,
No,
I
I
thought
think
you
it's
were
really
gonna say
interesting. So to help me differentiate step one and step two, like step one is
something.
really we're organizing things based on not just med name. We're not just listing them amlodipine through, you know,
Right.
Zyprexa. Like that's not the way that we're laying things out. We're actually
Mhm.
trying to go organize them from what are they being used for? Are they effective or not? And what was the third thing, Donna?
So, if it's effective, if the problem still exists,
It still exists.
and yeah.
And now the second piece, though, when you said you're
Mhm.
evaluating like those elements in play, you're now asking those questions. Like that is the next step of going,
Yeah.
"Well, we've answered these things. We're asking deeper."
Yeah. Yeah, so now we're starting to develop the questions to ask, right? Whether we as pharmacists, what we're going to be asking the providers, or what the patient needs to ask the provider. So, so that is really that whole review and asking those questions. Now, the third part is the conversation, right? So now we're moving on to the providers that are going to, be making some changes, hopefully. And I call this the do conversation. So, do you prescribe to optimize? We have to do the conversation, right? So, this is the do. And this is when you start deciding what's important. And the prescriber might say, no, you really need this because you have this arrhythmia. And if you stop taking this medicine, it's probably going to be an issue. You've talked about palpitations or things like that in the past. So we want to
Yeah.
make certain we keep that resolved. So, so you have these conversations, and there could be a reason why you're still taking something. But then you also have those conversations of, yeah, like, where are you coming from? Oh, you're fearful of falling and you do have some risks. So let's start looking at these medicines to help reduce the medicines and reduce your risk of fall. So yeah, I mean, these can be really great conversations that you have with your provider. So this is the whole like decision, right? And you're not going to stop everything at once. Maybe you're talking about, like, what's important to you. What's really important to me is that I don't fall. I don't want to fall. That's the most important thing to me.
Yep.
So, taking off medicines for that might be more important versus, you know, um, I really don't think I need this sleeping medicine anymore kind of thing, which,
Yes.
also helps with falls, but it's a very specific thing.
Of course.
So having these conversations is really important.
That's like a united front. Like you're saying, like, hey, let's develop the list, let's get the right
Mhm.
questions, and now let's develop this relationship back and forth so we can
Yeah,
really get to the root of what we want to have going on.
right. And what I hear from a lot of patients too is that they say, "I don't have a lot of time." So pick something and keep your lists with you. And in each time, like what is important to you, have that conversation. So then you need to make a plan. So, okay, yes, we're deciding we are going to start to reduce XYZ medicine. Okay. So how are we going to do this? And instead of writing a prescription, we're going to write up a prescription and talk about what's the medicine so that there's no confusion. Write it down, right? So the providers can write it down for the patient. There's a whole form. I have forms available that that folks can use and pharmacists can use to really help patients. Providers can use these too, but it really is important that we're talking about the same medicine because there's confusion. There's a lot of the medicine that begins with an L might be different in our patient's mind than it is in what the provider is talking about. So we want to make certain we're all on the same page. And then how we're going to reduce that. Can it just be stopped? Does it have to be tapered slowly? Are you just reducing it? Are you switching it to a safer alternative? So those are all things that's all part of deprescribing, as we know. It is not just always stopping. It's could be just making some changes. So thinking about that form, and then let's think about um, having to monitor. So what does the patient have to do, right? Do I have to start taking my blood pressures a little bit and recording that? Maybe you have to take care, just see what your mood is if you're changing any kind of behavioral mind medication. So what's your mood been lately? How do you feel? How are you sleeping? Like anything, you could monitor anything. And have to maybe journal that for a week or two. Maybe you have to go for a lab. What lab do you have to go to? Maybe you have to get your sodium levels checked. Maybe your potassium levels checked.
Yes.
Maybe your, so various things that we want to be thinking about. Maybe you have to go back for an EKG and have the QTC checked too. So many things. And we want to make certain that people are aware that this lab is necessary for us to know if we're going in the right direction, right?
Right.
So that whole plan is all a part of that. And then going home with that plan and knowing what to monitor. And
Yeah.
then after that, having an appointment. So when you go back to that follow-up appointment, which is your step 5, right? You have written down and you've documented what you're monitoring, and having that follow-up to make certain that, yes, we're in a good place, or you know what, maybe we have to slow down this taper, or how are you feeling? Like, is this a help for you? But the big thing that we all have to be thinking about is no change is possible. And it might be that the patient never even, never really needed the medicine, or they don't feel any different, but that's okay because it's not benefiting them either. so, so be thinking just as good as improvement. What we are really concerned about is somebody not improving, feeling worse, and then what do we have to do with that? So, but
Wow.
that is rare. It's not as common as that happens as people feeling better and being able to eliminate unnecessary medicines. So, those are the 5 steps. List all the medications, review the med list, the do conversation, make a plan. And then with that plan, we want to make certain that we go home and that we monitor appropriately, document, and follow up.
Wow. Yeah. I mean, I think it's so funny, Donna, when you're mentioning these things, like I'm thinking of all the scenarios that I'm sure you've seen more in your career. I've seen a number in my career that I'm thinking, I've seen this, like I've seen it streamlined that someone just started on amlodipine for blood pressure. And then all of a sudden they're taking 10 milligrams and now they've got overload of fluid. Now they're on furosemide. Now they can't sleep at night. And all of those elements just really add up to needing these 5 steps. so that you can break things down from the very beginning and then
Right.
tier them in the right direction so you can take care of that patient. Because as you mentioned, like putting everybody on a drug holiday isn't a great option for a clinician to say, you know, I'm just going to stop the meds. You know,
Right.
now we've proliferated the issues. And the other thing that I'm wondering, I'd love to hear your opinion before we switch over to the RPhAlly side that I hope
Mhm.
everyone joins us, is how to eat the elephant, Donna. I feel like that's one thing I'd love to leave the audience with, because sometimes doing this, they can go, so I'm going to go and I'm going to optimize my meds, write the entire list down, and then change all of these things at once.
Mhm. No,
No.
absolutely not. Yeah.
Yeah.
Yeah, you got to definitely do it in, like you said, small chunks, eating the elephant, right? And what's really important though too is, in order to get the buy-in from the patient too, you probably want to start with things that they're really not going to feel. You want to make certain that you're starting off with, or something that's going to make them feel much better. So if iron's not needed anymore, let's stop the iron, so that, and now they're not constipated anymore.
Yeah.
And so if you do those types of products first, then you kind of get some trust going with the patient, like, oh, I feel really good now.
Yeah.
And then you're able to move on. But it's a process. It can take months. There are a lot of cases written in the medical literature, and it's months and months and months of people working with their providers to reduce their medicines. But I can tell you, um, I've I've worked with patients, and we've reduced like half of their meds easy, and it's so doable.
Oh, awesome. What a big relief for patients and for providers in general. It's just a huge burden. So thank you guys
Mhm.
so much. Don and I are going to flip over to the RPhAlly side of things and go in even deeper with the patient case here. But we'd love for you guys to join us. Join us through RPhAlly and find Donna on her Deprescribing channel. We'll talk to you guys soon.
Thanks, Kevin. Bye, everyone.